Thanks, Chelsea. The holidays can be a happy and exciting time full of friends and family. But for those living with mental health conditions, the expectations or sentimental memories of the holiday season can definitely take its toll.
Joining us this morning is Elizabeth Lutz with the Health Collaborative, an organization dedicated to improving health in San Antonio. And Elizabeth, we always hear that suicide tends to spike around the holidays. I think it's probably we just hear about it more often because it's the holidays.
Right, and this time of season really brings up a lot of memories, just as you opened up and said, there's a lot of families that have gone through loss. There's a lot of trauma that maybe has happened that has not been addressed, and so these holiday seasons definitely stir up a lot of those emotions, especially seeing other families be very happy or seeing other people be very happy. Sometimes that also causes some stir up and some of those emotions that cause them to rethink about what is happening in their own lives.
What could you do as far as helping a loved one, a friend, a family member? How can you tell that they're even having these thoughts? Sometimes you don't find out till it's too late.
Right, and sometimes once you start seeing some of those signs, oftentimes they've already thought about it for a long period of time. Ideally, you look for things like isolation or anger bursts. It could be that people just start talking or joking around about suicidal thoughts. Mm-hmm. These are all quick signs or things that you can pick up on, and just have an open conversation and really ask the question, is everything okay? What can I help you with? Are you thinking about, just take the conversation more serious. I think a lot of us feel like, oh, they're just joking around, or something like that. Try as hard not to be dismissive because a lot of these people, these small signs can actually be they're calling out for help.
But the thing is, a lot of people, even if they think this might be the reality of the situation, a lot of people simply don't either know how or don't want to address the issue.
And I think at this point, this is where we really need to start thinking about compassion and really trying to put ourselves in the situation of those people, family members, and trying to understand what thoughts or what might be happening with them outside of what they're sharing with you visibly. And you're right, a lot of people shy away from asking those questions because they don't know how to respond or they won't know what next action to take. And it's really important to know from the community perspective that there are a lot of agencies here locally, nonprofits, that are working to be able to help build a network of support for these families. We have many organizations like the National Alliance for Mental Illness, we have the San Antonio Clubhouse, we have a number of different agencies that are at the ready to be able to help with that next step. But really the first step is identifying it and making it a common conversation instead of just walking away from it. So the Health Collaborative, we put together a community health plan, a health improvement plan that we released in October, and one of the key strategies is mental health and behavioral health in our community. Over 120 partners came together to say, this is what we need to do, and these are the resources that we can bring together to help support families in these very difficult conversations.
Yeah, so just ask. Don't even hesitate if you think something could be wrong.
Absolutely.
All right, Elizabeth Lutz, thanks for coming in this morning.
Thank you.
We certainly appreciate you.
Thank you.